Hey there, viewers. Do you like bacon? Who doesn't? While some say bacon is bad for your health, others would claim it has several benefits. What should we believe? Who should we listen to? Do we keep eating bacon or stop altogether? In today's video, we'll be talking about what happens to your body when you eat bacon every day. Is it healthy, unhealthy, or a mix of both? Will you get cancer? What about heart diseases and hypertension? We'll be talking about all of these and more. 1. You'll get both healthy and unhealthy fats craving a bacon, egg, and cheese sandwich. It makes my mouth water, but let's settle the taco about fats first. Do you get unhealthy fat from bacon? What about healthy fats? The answer is both. Bacon has both unsaturated and saturated fats. 50% of bacon is made from monounsaturated fats and 10% is polyunsaturated. I don't want to confuse you with these complex names, but it's important you know them. Both types are great for your body. They actually help bring down your blood cholesterol levels. This in turn helps reduce the risk of a heart attack. But bacon has saturated fats as well. They make up for 40% of bacon. In small quantities, saturated fats aren't too bad. Be careful not to eat too much bacon daily. It can harm your health in the long run because of the presence of saturated fats. Which kind of bacon is your favorite? Do you like eating it for breakfast or in your burger? Share your preferences with the community in the comments below. 2. You'll get heart disease. We often hear red meat is bad for your heart. Bacon is red meat. So certainly the risks plaguing red meat also apply to bacon. But what makes it unhealthy for your heart? The answer lies in saturated fat found in bacon. Saturated fat tends to deposit your arteries, causing plaque buildup. With time, your arteries harden and the blockage reaches astounding levels. If you don't get medical attention, you might have a heart attack. Saturated fat in bacon forms plaque in your blood vessels and arteries, which gives you heart disease. Plaque in arteries runs a special risk, as they carry oxygen to your heart. Now you get the picture? Eating bacon every day can be a health hazard because of plaque formation. If this plaque breaks off, it can form a blood clot. And blood clots are extremely dangerous because they can reach vital organs like the lungs, brain, and heart. They can even cause a brain hemorrhage. If you let plaque continue, it will cut off blood supply to your heart. But this doesn't mean you can't eat bacon. Just be careful of your portion size. According to experts, limiting yourself to one bacon serving a day is okay. 3. You might experience gut imbalance. Have you ever felt uneasy after eating bacon? Like your digestive system's upset with you? Turns out bacon can give you a gut imbalance. Wondering how? Bacon comes with a lot of grease. Eating greasy foods, high in saturated fats, can cause an imbalance in your gut microbiome. An imbalanced gut will damage your stomach lining. Balance fats you get from bacon with healthier ones. For instance, eat more fish like salmon, tuna, and mackerel. 4. They have omega-3 fatty acids. Avocados are great too. They're super rich in healthy fats. You get tons of vitamins while the focus tends to be on the fats it contains. Bacon also comes packed with lots of important nutrients. It's especially rich in vitamins, including B6 and B12. Bacon also has iron, zinc, and magnesium. All these vitamins, especially vitamin B12, are very important for your body. Vegetarians often lack B12 since you usually get it from animal-based foods. Whatever you do, just remember it's important to balance the need for vitamins. There are other leafy vegetables and healthier B12 sources you can consider to balance your diet. 5. You can get cancer. Bacon is a processed meat, which falls under Group 1 carcinogens. Wondering what those are? A carcinogen is a term for things that can cause cancer. Processed meat has a greater risk of giving you cancer, specifically colorectal cancer. Eating even 2-3 bacon slices a day increases your chances of bowel cancer. Don't worry, it's not just processed foods that will give you cancer. It also depends on the rest of your lifestyle. Maybe you stick to a balanced diet along with the bacon you're eating on a daily basis. 6. Eating it regularly can lead to diabetes. There are nearly 33 million Americans who suffer from type 2 diabetes. Diabetes is called the silent killer. This chronic illness affects various parts of your body. It can even cause vision loss and kidney failure. If you're eating bacon regularly, you're at a higher risk of getting diabetes. Research has shown that processed meats like bacon increase your risk of diabetes. Unfortunately, it's still not clear why this happens. People with a healthy lifestyle can avoid these health effects. 7. Bacon fights depression and anxiety. Don't we all feel happy after bacon? Turns out it isn't just the taste that wins your heart. There are psychological reasons behind bacon making you feel happier after meals. This is because bacon contains zinc and magnesium. Depression and anxiety are closely linked to zinc and magnesium deficiency. Research found that 250 milligrams of magnesium daily for 6 weeks helped depression. The same is true for zinc. Experts analyzed more than 15 studies to find the correlation between zinc and depression. It was reported that lower levels of zinc are linked to higher instances of depression. Your body needs a lot of zinc for a variety of functions, including keeping your brain healthy. It also regulates nerve paths. When it comes to getting the benefits of zinc and magnesium, bacon is on par with what fish offers. In fact, a 3-5-ounce serving of bacon provides 23% of your zinc needs, whereas the same amount of salmon gives you only 3%. But before you go all in on bacon, remember the unhealthy fats. Moderation is key, my friend. 8. Eating bacon every day can be bad for your mental health. It's true, bacon does have nutrients that help with depression. But there's also worry that too much bacon can actually be harmful to people with psychiatric issues. Research shows that eating processed foods, like bacon and salami, is detrimental to your mental health. 9. You'll have a stronger immune system. Magnesium ensures there's no replication of cells, which reduces your risk of cancer. Zinc, on the other hand, helps heal wounds faster. It also regulates your immune system from overreacting. 10. You can get high blood pressure. One of the downsides to bacon is that it has huge amounts of sodium. Too much sodium leads to health problems like high blood pressure and hypertension. If you're already suffering from hypertension, you need to stay away from bacon. Experts recommend Americans limit the amount of sodium they eat to less than 200-300 milligrams a day. A 3-5-ounce serving of bacon comes with 1,030 mg of sodium. That's a bit too much for me. 11. Should I eat bacon or avoid it? I get how difficult it is to stay off bacon. It's delicious. So is there a way to keep eating bacon without harming your health? Most of the downsides that come with eating bacon are due to nitrates. This is usually because of the preservatives that are added to processed food. That being said, if the bacon you're eating has additional additives that provide vitamins C and E, they'll prevent the negative effects of these nitrates. Glad we sorted bacon out for you, but it's just one food. There's confusion around other foods as well. Do you eat bacon every day? Are you planning to cut down? Let us know in the comments below. Top 9 skin signs that may indicate your kidneys are damaged. It is important to know that skin changes usually appear when you've already been having problems with your kidneys for a while. Remember, early detection and treatment can make a world of difference in kidney health. According to the latest studies, more than 800 million people worldwide may experience chronic kidney disease. So, if you have any risk factors such as high blood pressure, diabetes, or obesity, or if you suspect kidney problems, check for these skin signs and discover helpful tips for keeping your skin healthy. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Skin signs of kidney disease. Some skin changes are specific to kidney disease, whereas other changes in the skin are non-specific and may be associated with a variety of medical problems. 1. Itchy skin or pruritus. This is one of the most common skin symptoms in people with kidney damage, occurring in as many as 40% of people with end-stage renal disease, or ESRD for short. But what causes this itchiness? When the kidneys cannot effectively filter out waste products, urea accumulates in the blood. This buildup can lead to uremic pruritus, the medical term for itching caused by kidney disease. Itchy skin can occur anywhere on the body, but it commonly affects the back, legs, and arms. It is intensified by sweat, dry skin, and heat. While it may sound mild, this itchiness can be so intense and persistent that it can lead to a poor quality of life. When the pruritus is severe, the urgent need to scratch leads to more severe skin problems. Scratching may cause scrapes, or excoriations, on the skin, thicken, leathery skin, or skin lichenification, or raised bumps, or prurigo nodularis. Ongoing scratching can cause lesions to bleed, and a compromised skin barrier becomes an easy way for bacteria to enter and lead to more severe infections. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 2. Rashes. Rashes are also a common skin sign in people with kidney damage caused by poor elimination of toxins that build up in the skin. Acquired perforating dermatosis is a type of rash that appears in individuals with end-stage kidney damage in the form of small, pigmented, itchy bumps with a scaling center. These bumps can usually be found on arms and legs. Less commonly, they may be found on the trunk, scalp, and buttocks. As the bumps heal, new ones can appear, creating lesions in multiple stages of healing which may join together to form larger patches. Although these rashes are often itchy, you should avoid scratching because it can lead to worsened skin conditions. 3. Blisters. Blisters may also occur in people with kidney damage. They often appear as fluid-filled sacs on exposed areas such as the backs of the hands, forearms, or, less often, on the feet and the face. Kidney damage is just one potential cause of blisters. Blisters can be caused by infections, medications, poor diet, and heavy alcohol intake. Blisters associated with kidney damage can vary in size and severity. They may be accompanied by other symptoms such as pain, redness, and swelling. Unfortunately, when blisters heal, they dry up and develop a crust that later peels away, usually leaving a scar and skin discoloration. Calcium deposits. Calciphylaxis is one of the most severe skin conditions associated with kidney damage. It occurs when calcium accumulates in small blood vessels, leading to painful sores and ulcers. It's a rare but serious condition that occurs in up to 4% of patients undergoing dialysis and requires immediate medical attention. The exact cause of calciphylaxis remains unclear, but several factors can increase the risk. High blood calcium levels. This often happens due to imbalances in calcium and phosphate. Dialysis. Long-term dialysis patients are more at risk. Obesity, higher body mass index, or BMI, can be a contributing factor. 4. Medications. Certain medications can impact calcium metabolism. Patients with calciphylaxis describe painful, pink or purple bumps or plaques that develop into deep, painful ulcers covered with black crusts, usually located on the abdomen, buttocks, and legs. Another type of calcium accumulation is represented by calcinosis cutis, which refers to calcium deposits under the skin. These are usually firm white nodules near joints that may break through the skin and release a white chalky discharge. Calcinosis cutis are usually not painful unless they are located in the fingers or toes. 5. Dry skin xerosis. Dry skin or xerosis is one of the most common skin signs of kidney damage. However, dry skin is nonspecific, as it can be caused by a number of conditions besides kidney damage. Dry skin occurs in 50 to 80% of individuals on dialysis, and here are a few common causes. 1. Poor hydration. 2. Decreased sweat gland activity. 3. High levels of vitamin A. 4. Long-term use of diuretics. 5. Xerosis. Usually occurs in those who have been dealing with kidney damage for a while and are on dialysis, which often causes skin to become dry, rough, and scaly. People with cirrhosis also experience tight skin that can easily crack, leading to exposed entryways for bacteria. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. 6. Swelling. The kidneys have many functions, one of the most important ones being the elimination of excess water and salt from our bodies. If your kidneys are damaged, water and salt may not be eliminated properly, leading to a buildup of fluid. This water and salt retention causes swelling and puffiness, especially in the hands, feet, and face. If your legs feel puffier than usual, press them with your finger to see if it leaves an indentation, called pitting edema. If you experience swelling and puffiness, you should see your healthcare provider to have your kidney function evaluated. 7. Changes in skin color. The presence of kidney damage can lead to a buildup of waste products in your bloodstream, which may cause your skin to change color, often with gray or yellow hue. This discoloration results from the toxins that are not being filtered and excreted in the urine. Skin hyperpigmentation may also occur as a result of a buildup of melanin, and it may be seen as a dark brown color. Skin pallor, or paleness, is commonly observed in individuals with chronic kidney disease caused by anemia. Another skin discoloration related to kidney damage is uremic frost, a white, powdery substance left on the skin's surface after sweat dries. Excessive scratching may also change the color or texture of your skin. 8. Nail disorders. Many medical conditions can cause nail changes, including kidney disorders. In a study of 100 patients, nail changes were found in 60% of individuals with CKD. In another study of 101 patients with severe renal disease who were on dialysis, hair, mucosal, and nail disorders were found in 23–45% of the patients. On your finger or toenails, you may notice one white transverse band, called Mees line, or multiple bands, called Morch's lines. These can appear in people with kidney damage due to stress or low protein levels in their blood. Another frequent finding is the half and half nail disorder, also known as Lindsay nails, characterized by a brownish color at the top of the nails from increased melanin and a white or pink color at the bottom of the nails due to an increased number of small blood vessels. Less common changes are splinter hemorrhages, which are small red or brown lines under the nails that resemble splinters. They can be a sign of underlying health issues, including kidney damage, and they are caused by small blood clots that damage the capillaries under the nails. Keeping nails trimmed and moisturized can reduce the risk of nail disorders. 9. Hair disorders. One of the most troubling symptoms for individuals with kidney damage is hair loss. This condition, medically known as alopecia, can have an impact on self-esteem and quality of life. Hair loss can result from several factors associated with kidney disease. Notes 1. Nutritional deficiencies. Kidney damage often leads to imbalances in essential vitamins and minerals, such as iron and zinc, which are critical for healthy hair growth. 2. Hormonal imbalances. The kidneys regulate many different hormones that affect hair growth. When the kidneys are not working properly, it can lead to hormone dysregulations which can affect hair growth cycles. 3. Medications. Some of the medications prescribed for kidney disease, including certain blood pressure medications and immunosuppressants, can contribute to hair thinning and loss. Dehydration and dialysis treatment can strip hair of natural oils, making it more dry and brittle. It is important to remember that hair loss and hair shedding can occur from a variety of medical conditions. If you are experiencing a sudden increase in hair shedding or patches of alopecia, see your healthcare professional to help determine the cause. What can you do? We covered many skin signs, some more severe that would make us call our doctor, and other more common ones that may not necessarily be related to kidney damage. So, the question that follows is, when to seek medical help, and who to consult for these symptoms. As this video shows, some skin symptoms are more specific or serious, and clearly require a visit to a healthcare provider. But what do we do about those less alarming symptoms that we might ignore or confuse with other causes? Kidney damage affects many people, but there are some risk factors for kidney disease that you should consider when you notice skin changes. If you are over 60 with other conditions such as high blood pressure, diabetes, or obesity, pay close attention to your skin and nail changes, even seemingly ordinary ones. You should contact your primary care doctor at any sign of skin changes. Blood and urine tests will help diagnose kidney problems, allowing you to start proper treatment recommended by a nephrologist or kidney doctor. You must communicate well with your doctor, who can explain your condition and how to prevent further skin changes. If you have severe or persistent skin symptoms, you should see a dermatologist or skin doctor who can collaborate with your nephrologist. How can I manage these symptoms by myself? After being diagnosed, you should initiate proper treatment, but you should not rely only on medication. Our lifestyle and day-to-day practices play a key role in the healing process. For you need to make important changes to manage kidney damage. These changes include 1. Diet and nutrition. Eating a balanced, kidney-friendly diet is important for your skin health. Monitor your salt, protein, phosphate, and calcium intake. Quit smoking and limit or avoid alcohol consumption. Search for new recipes or talk to a nutritionist who can recommend dishes based on your favorite flavors. 2. Hydration. Drinking enough water can help keep your skin hydrated and reduce dryness. However, if you have kidney issues, especially if you are on dialysis, overhydration can lead to fluid buildup. To manage thirst when restricting fluids, eat pieces of frozen fruit, drink small sips, or rinse your mouth with mouthwash. Consult your healthcare provider to determine your ideal water intake. 3. Moisturizing. To combat dryness and itchiness, moisturize your skin at least once a day. Use fragrance-free hypoallergenic moisturizers to avoid irritation. Emollients that contain salicylic acid or urea and a gentle skincare regimen can be useful. 4. Avoiding hot showers and baths. Hot showers can strip your skin of its natural oils, making it dry and itchy. Avoid long baths and try taking short showers with lukewarm water. 5. Avoiding harsh skincare products. Avoid using harsh soaps and skincare products that can irritate your skin. Stick to gentle, fragrance-free products designed for sensitive skin. 6. Sun protection. Sun damage can worsen skin problems, especially if your skin is sensitive. Use sunscreen with at least SPF 30 to protect your skin, even on cloudy days, and reapply it throughout the day. 7. Comfortable clothing. Wear loose-fitting, comfortable clothing made from natural fibers like cotton. This can help prevent irritation and allow your skin to breathe. 8. Regular checkups. Regular checkups are essential for monitoring your kidney function and overall health. Discuss any new symptoms or concerns with your doctor during these visits. What is the most important takeaway from this video? When it comes to kidney health, recognizing skin signs is crucial for early diagnosis and effective management. Kidney damage often causes specific symptoms like itchy skin, rashes, blisters, and calcium buildup in vessels and skin. It can also lead to nonspecific signs such as dry skin, swelling, changes in skin color, nail and hair disorders. Each of these symptoms signals potential underlying renal problems. Itchy skin, for example, affects 90% of people on hemodialysis due to the buildup of waste products like urea. Similarly, rashes, blisters, and calcium deposits signal that the kidneys struggle to eliminate toxins effectively. Although less specific, nail and hair disorders should not be ignored, especially in those with associated risk factors, as they can signal deteriorating kidney function. People with kidney disease should watch for these symptoms, especially if they are at high risk. Due to factors like age over 60, diabetes, high blood pressure, or obesity. Early detection can significantly improve treatment outcomes. Seek immediate medical help when these signs appear. Blood and urine tests will confirm the diagnosis and pave the way for proper treatment, often involving collaboration between a nephrologist and dermatologist. Managing these symptoms involves more than just medical treatment. Lifestyle changes play a crucial role. These include maintaining a balanced diet, staying hydrated without excess, using gentle skincare products, avoiding hot showers and harsh soaps, and ensuring proper sun protection. Such changes can greatly improve your quality of life and skin health. In conclusion, recognizing and addressing skin signs linked to kidney damage on time helps diagnosis and management of the condition. Adopting a proactive approach helps manage the symptoms and improves overall kidney health and quality of life. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. See you again. Stay informed. Stay healthy. If you eat eggs every day, what happens to your body? Have you ever heard of an egg diet? Eating eggs is a fantastic way to give your health a boost. According to WebMD, each egg only contains 75 calories and is packed with 7 grams of protein, 5 grams of fat, and 1.6 grams of saturated fat. Not to mention it contains iron and other essential vitamins and minerals. Eggs have several health benefits. They also contribute to healthy brain development and bone health. For example, did you know that eating eggs during pregnancy can also help a baby's brain development? This is due to the yolks being high in choline. If you're not eating eggs on a regular basis, you should be. Now, keep watching for the 6 things that will happen to your body when you eat eggs. Before we begin this video, don't forget to subscribe to our channel for more daily health tips like this, and turn on notifications so you never miss our new videos. Number 1. Boost your weight loss. Did you know that eating eggs can actually boost your weight loss? Many people are surprised when they hear this, because they've been told that eggs are unhealthy and fattening. But a study done by the Rochester Center of Obesity Research found that eating eggs for breakfast actually helps limit your calorie intake throughout the day by over 400 calories. Researchers from this study concluded that by just eating eggs for breakfast, you could lose 3 pounds a month. The reason why eating eggs can help limit your calorie intake is that they curb your appetite. So if you find you're hungry, try eating some eggs. When you eat eggs, you'll start to notice that they make you feel full, which can take away unnecessary cravings and help prevent you from munching on snacks and foods that aren't the best for you. So if you're trying to lose weight, try adding some eggs to your diet. You won't regret it. Number 2, help your body prevent breast cancer. Research that was conducted by Harvard University found that eating eggs as an adolescent could help prevent breast cancer. Researchers at the University of North Carolina found that choline, which is in eggs, transcripts can help reduce breast cancer by 24%. The daily intake recommendation for choline is 550 milligrams for men and 425 milligrams for women. One egg contains 125.5 milligrams. So if you consume 2 eggs, you're almost halfway to consuming your daily intake. So make a change to your healthy diet to help improve your overall health and reduce the risk of different types of cancer, like breast cancer. Now, while eggs may be able to help protect you from breast cancer, it's not to say that it will prevent you from getting cancer. So always be sure to speak to a doctor or medical health professional first if you're looking for some information about how to prevent certain types of cancer. Do you know how many eggs researchers suggest that we eat every day to maintain a healthy lifestyle? Well, stick around until the end to find out some more health tips about eggs. Number 3, reduce stress and anxiety. A study was published in 2004 in Proceedings of the National Academy of Sciences. And researchers found that when people had sufficient lysine sources in their diet, their stress and anxiety levels were reduced. The researchers believe that lysine modulates the serotonin in the nervous system. Can you guess what food has high amounts of lysine? Stress and anxiety can also have a huge impact on your weight and your diet. When people are stressed out, they tend to eat more or less. This can lead to weight gain or unhealthy weight loss, both of which can be detrimental to our health. In addition to this, stress and anxiety can affect your sleeping patterns. So try to eat more eggs to reduce your stress and your anxiety. Number 4, protect your eyes. There are 2 types of antioxidants in eggs, lutein and zeaxanthin. They both have protective effects on your eyes. Both these antioxidants are found in the yolk. What these antioxidants do is reduce the risk of cataracts and macular degeneration. A study published in the American Journal of Clinical Nutrition found that participants who consumed 1.3 egg yolks per day for almost 5 weeks increased their blood levels of zeaxanthin by 114 to 142% and lutein by 28 to 50%. Number 5. Lower inflammation. Eggs contain dietary phospholipids, compounds which have huge effects on inflammation, according to studies. In fact, a recent study published in the journal Nutrients found that there was a connection between dietary intake of egg phospholipids and choline and the reduction of inflammation. By lowering inflammation in the body, you reduce the risk of cardiovascular disease, according to Paul M. Ridker, Director of Center for Cardiovascular Disease Prevention at Harvard-affiliated Brigham and Women's Hospital. Number 6. Protect your liver. As mentioned already, eggs have high levels of choline. A review was published in the journal Advances in Nutrition, and it explained that choline deficiency is linked to the buildup of hepatic lipids, which have the ability to cause non-alcoholic fatty liver disease. The good news is that a study found in the Journal of Nutrition found that women who had high choline diets lowered the risk of experiencing non-alcoholic fatty liver disease. Cholesterol is an important part of the cell membrane, and the liver produces large amounts of it every day. When we eat eggs, the liver doesn't have to produce as much. This structural molecule is responsible for making testosterone, estrogen, and cortisol, which are all very important contributions to the function of the human body. Basically, if we were to consume a large portion of eggs, say 3 of them, it would even out with the liver to make sure the body gets the correct levels of cholesterol. So, now that you know what will happen to your body if you start eating eggs, what do you think? Eggs are great for your health. But you should also remember that all of our bodies are different. The effects of consuming whole eggs can vary person to person. For the most part, the majority of people consuming eggs experience mild to no alterations in cholesterol levels after consuming high amounts of dietary cholesterol. In fact, the 2015-2020 Dietary Guidelines for Americans has actually dropped their limit on dietary cholesterol, and the government's expert panel has expressed that it is no longer a concern. So, is there a limit to how many eggs we should be eating? How many eggs are too many? Well, studies suggest that we should eat between 1 to 3 eggs a day. Although there are studies showing that it is safe for us to consume up to 3 eggs a day, there are no studies showing what happens when people consume more than 3 a day or more than 21 a week. Another thing to keep in mind is that there are different types of eggs. The healthier eggs are richer in omega-3, or come from hens raised on a pasture. Eating 3 of these eggs a day could contribute to nutritional differences over time. Eggs are a great food to add to your healthy diet. To help with your overall health and bodily functions with all sorts of health benefits. There's no denying that eggs should be a staple in anyone's diet. Eggs can help fight iron deficiency and protect eyesight and help with healthy weight gain. Basically, you should make eggs a staple of your diet right now. So what are you waiting for? Get started on your new healthy diet today and reap the rewards. How many eggs do you eat a day? What are some other types of food that you eat to maintain a healthy lifestyle? And do you have any health tips for getting started on a healthy diet? Let us know in the comments section below. Hit the like button and share with your friends. Subscribe to our channel for more videos like this. Thanks for watching. Avoid these 7 plant-based foods that can damage your kidneys. In recent years, many experts have suggested the benefits of a plant-based diet and reducing the strain on your kidneys. But just because something is from a plant doesn't mean it's good for your kidneys, particularly if you have kidney disease. In reality, some plant-based foods can actually pose risks, and cutting back on them would bring lasting rewards. Watch this video to learn 7 plant-based foods you should avoid to protect your kidneys. Before we dive in, please note, All the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 7. Seed oils. Seed oils are plant-based cooking oils obtained from seeds. Examples are rice bran, canola, corn, cottonseed, grapeseed, soybean, sunflower, safflower, and peanut oils. These oils are promoted as valuable lipid sources due to their healthy fatty acid content and bioactive compounds. However, these oils have undergone extensive processing, including bleaching, refining, and heating, to extract and clean them before they can be used for cooking and baking. Refining can strip away essential nutrients like antioxidants and sometimes produce unwanted compounds. One example is trans fatty acids, one of the most harmful compounds for your kidneys and overall health. More concerning, seed oils can contribute to inflammation in the body due to their high omega-6 fatty acid content. Inflammation is the root cause behind a long list of health conditions like kidney disease, arthritis, heart disease, and diabetes. Small amounts of omega-6 fatty acids are necessary for your overall health. However, excessive consumption, typical in Western diets, can disrupt the balance between omega-6 and omega-3 fatty acids, leading to health problems such as kidney damage. Fats are divided into saturated and unsaturated types. Unsaturated fats found in oils like olive oil are healthier, offering benefits such as improved cholesterol and heart health. Saturated fats found in animal products and some plants like coconut should be limited. Replacing saturated fats with unsaturated ones can minimize the harm caused by seed oils. Opt for unrefined oils, such as extra virgin olive oil, which retain more natural nutrients, flavor, and aroma. Because they are extracted using methods like cold pressing without high heat or chemicals, unrefined oils are tastier, healthier, more natural, and free from harmful additives. This purity and nutrient retention support overall health, including kidney function. 6. Canned vegetables and canned soups. Canned soups and vegetables are commonly consumed because of their low cost and convenience. However, these foods typically contain high levels of sodium for preservation, which can be problematic for those with kidney disease. When the kidneys are not functioning properly, they cannot effectively filter out excess sodium from the blood. This leads to a buildup of sodium, which can increase blood pressure and put additional strain on the kidneys. It is worth emphasizing that canned foods often contain added sugars or chemical additives. This is why individuals with kidney disease should avoid or limit canned foods, including canned vegetables. Instead, look for fresh or low-sodium alternatives. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 5. Chips and pretzels. Baked chips, despite their reputation as a healthier alternative to the fried version, can still pose risks to kidney health. Baked chips are highly processed and low in fat, making it easy to overeat without feeling full. Pretzels are processed baked bread snacks, which can raise blood sugar levels and promote fat storage. These effects can contribute to kidney damage over time. Potato chips and pretzels are also low in essential nutrients like fiber and protein, and can contribute to weight gain and obesity, potentially damaging your kidneys over time. Worse still, both chips and pretzels can contribute to high sodium intake, which can strain the kidneys by causing fluid retention and elevated blood pressure. High salt intake may worsen already existing kidney damage and increase the risk of cardiovascular complications like heart attacks and strokes. Try to moderate your intake of these foods in favor of healthier snack options to support kidney health. 4. Ketchup, Ketchup is made from tomatoes, which are high in potassium. An excessive potassium intake can be problematic for those with poor kidney function. Also, ketchup is often high in added sugar and sodium, which can contribute to high blood pressure and strain on the kidneys. 1 tablespoon, which is 17 grams, can contain 180 milligrams of sodium and 4 grams, which is equivalent to 1 teaspoon of sugar. It's best to choose options that are low in these ingredients, especially those that don't include high fructose corn syrup. The sugar in ketchup, like high fructose corn syrup, can lead to obesity and insulin resistance, making kidney function worse. Ketchup also has lots of phosphorus, which isn't good for individuals with kidney issues. Too much phosphorus can cause problems since damaged kidneys struggle to filter it out. It's important to avoid other store-bought condiments that might cause similar adverse effects. This includes salad dressing, barbecue sauce, and soy sauce, as they often contain high levels of sodium, sugars, or chemical additives. Rather than topping your favorite summer dishes with these condiments, consider using salsa. Choose fresh, salt-free salsa from the store, or make your own at home. 3. Instant noodles. Instant noodles are pre-cooked, dried noodles that are popular worldwide due to their convenience, long shelf life, variety of flavors, and reasonable cost. However, they are often criticized for being unhealthy due to their high sodium, carbohydrate, and trans fat content, and lack of essential nutrients like fiber, vitamins, and minerals. In 2017, Nutrition Research and Practice published a study involving 3,397 college students in Seoul, aged 18 to 29. The study aimed to understand how eating instant noodles affects heart and metabolic health. They found frequent instant noodle intake was linked to elevated levels of blood triglycerides and sugars and increased blood pressure. These effects can potentially cause diseases that lead to kidney damage. Instant noodles are a perfect example of ultra-processed foods, or UPFs for short, which can damage kidney function. UPFs are typically high in calories, refined carbohydrates, sugar, salt, chemical additives, and trans fats, and low in dietary fiber and essential nutrients. A 2022 study published in the American Journal of Kidney Diseases analyzed data from the Atherosclerosis Risk and Community Study, a major research initiative conducted in the United States. This study involved 679 middle-aged adults without kidney disease at baseline. After analyzing, the researchers found that each additional serving of ultra-processed foods, including canned soup, was linked to a 5% higher risk of chronic kidney disease, or CKD for short. These findings highlight the potential harm of canned soup and other ultra-processed foods on kidney health. A study conducted in Korea found that people consuming the most UPFs had a higher prevalence of CKD. The results demonstrated that every 6.6% increase in UPF consumption was linked with a 6% higher prevalence of CKD. This association may be due to the harmful ingredients found in UPFs, such as hydrogenated oils and chemical additives, which can cause oxidative stress and inflammation. Frequent consumption of instant noodles can harm the kidneys due to their high phosphorus content, which can raise serum phosphorus levels. Elevated serum phosphorus is linked to increased mortality and cardiovascular events. Efforts are being made to address these concerns and develop healthier versions. In Malaysia, for example, researchers have explored the use of composite flours incorporating locally available ingredients like seaweed powder to improve the nutritional value and quality of instant noodles, while reducing dependence on imported wheat flour. 2. Frozen meals. Pre-packaged vegan-vegetarian frozen meals frequently contain lots of salt, potassium, and phosphorus, which can be bad for patients with kidney disease. Excess salt and other preservatives are often added to make these meals taste better and last longer. Moreover, excessive potassium intake can be problematic for individuals with compromised kidney function, as mentioned earlier, because the kidneys struggle to properly regulate potassium levels in the blood. However, plant-based diets in kidney disease have been shown to be beneficial, as the potassium in fresh whole plants are paired with fiber, which prevents its absorption. Talk with your dietitian about the right plant-based diet for you. Similarly, additives containing phosphorus in processed frozen foods can contribute to elevated phosphorus levels in the blood, potentially leading to bone and heart complications in those with kidney disease. Therefore, frozen meals are generally not a good choice for people concerned about kidney health, especially if consumed regularly. To make frozen meals less harmful to kidney health, choose those with lower sodium and reduced potassium and phosphorus content. This involves carefully reading labels and selecting products with minimal processed ingredients. A better option is to prepare homemade meals using fresh whole food ingredients, allowing for greater control over nutrient intake. Try cooking large batches of kidney-friendly vegetarian or vegan dishes and freezing individual portions for later consumption. By prioritizing fresh, whole foods and mindful meal planning, you can enjoy a kidney-friendly diet while minimizing potential harm. 1. Chocolate bars or energy bars. While cocoa contains phenolic antioxidants and flavonoids that can help support the function of your blood vessels, chocolate bars should be consumed with caution. Chocolate bars have high levels of saturated fats and added sugar. These components contribute to high blood sugar, high blood pressure, and weight gain, which are common triggers for kidney disease. Chocolate bars and energy bars are also considered UPFs, which are linked with an increased risk of CKD and worsen complications in patients with CKD. As mentioned earlier, chocolate UPFs are typically high in energy, low in nutritional value, and contain additives that may be harmful to kidney health. Energy bars, often consumed for replenishing electrolytes lost during exercise, can pose significant dangers to kidney health. Similar to energy drinks, they often contain high amounts of sugar to provide a quick energy boost. Also, the combination of high sugar and other additives in energy bars leads to conditions that can cumulatively strain the kidneys. Thus, long-term consumption of energy bars can accelerate kidney damage. Therefore, it is essential to minimize your consumption of these processed bars and consider fresh fruits and other healthier alternatives. Are your kidneys damaged? Healthy kidneys filter about half a cup of blood each minute, getting rid of waste and excess water to produce urine. The urine travels from the kidneys to the bladder through two thin muscular tubes called ureters, one on each side of the bladder. The bladder serves as a reservoir, temporarily storing the urine. Together, the kidneys, ureters, and bladder make up the urinary system. When your kidneys are damaged, waste and fluid build up. Over time, this can lead to kidney disease and kidney failure, which can be either acute or chronic. Acute kidney failure is usually short-term and reversible, while chronic kidney failure is a long-term condition that is progressive. Symptoms of kidney damage can include nausea, vomiting, fatigue, sleep problems, changes in urination, decreased mental sharpness, muscle cramps, swelling of feet and ankles, itchy skin, and high blood pressure. These signs might not manifest until irreversible damage has occurred due to the kidney's ability to compensate for lost function. Kidney problems can cause anemia and bone and mineral disorders such as hyperkalemia, which can be deadly. Additionally, kidney failure can heighten the risk of heart disease or stroke. Without treatment, kidney failure is fatal. Doctors rely on biomarkers like creatinine levels, glomerular filtration rate, or GFR, and protein in the urine to assess kidney function. Newer biomarkers such as kidney injury molecule and neutrophil gelatinase-associated lipocolin show promise for early detection of kidney damage. Triggers for kidney disease include high blood pressure, high blood sugar, and high blood cholesterol levels. The increased force from high blood pressure injures the filtering units of the kidneys. Elevated blood sugar from diabetes can cause damage to small blood vessels in the kidneys, which harms the filters. Additionally, cholesterol forms plaques along the artery walls, blocking blood flow to the kidneys, which impairs their function and also causes protein loss in the urine. Other diseases and environmental factors can also contribute to kidney damage. Obesity increases the risk of chronic kidney disease, or CKD, by lowering urine pH, causing chronic inflammation, and disrupting fat metabolism. It also worsens high blood pressure, insulin resistance, and glucose intolerance, further raising the CKD risk. While CKD can be caused by various factors, including diabetes and high blood pressure, dietary choices play a significant role. This video has highlighted some plant-based foods to avoid, emphasizing the importance of opting for less processed alternatives. The one thing all of these foods have in common is that they are processed. From seed oils to flavored instant oatmeal, many processed foods contain additives that can worsen kidney disease. To maintain healthy kidneys, swap out high-sodium condiments like ketchup for homemade sauces with fresh herbs. Opt for antioxidant-rich fruits and vegetables. Choose lean proteins with less saturated fat and stay hydrated with water. By prioritizing whole, nutrient-rich foods and limiting processed options, you can support your kidneys and prevent pre-existing kidney conditions from getting worse. Remember, consulting with a healthcare professional is necessary. Especially if you have an existing kidney condition, your doctor and registered dietitian can provide personalized guidance to help you make informed dietary choices and maintain optimal kidney health. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Have you seen any signs from our video or worried about kidney disease? Your kidneys might need a natural boost. We also offer tips to get the most from them. See you again. Stay informed. Stay healthy. I'd like to discuss the common mistakes people make when they're taking vitamin D. Vitamin D is the most important vitamin because it's involved in over 10% of all of our genetics. It's a fat-soluble vitamin, which means that it absorbs better when you consume it with fat, whether it's MCT oil or olive oil or something like that. The absolute most important thing to know about vitamin D is that it won't work unless you have enough magnesium. The thing about magnesium, it's the second most important nutrient because it's involved with 300 different enzymes. Magnesium regulates the excess amount of calcium that builds up in your arteries. You don't want to just take any old magnesium because the one called magnesium oxide, you do not want to take that. It only absorbs like 3 to 4%. And you're going to get diarrhea usually, if you take more than that. A better one would be magnesium glycinate. You take that in the evening, it'll help you sleep. You get like an 80% absorption. If you take magnesium citrate, okay, that's fine too. The other side note I want to mention about magnesium is that the more vitamin D that you take, the more magnesium is going to be required. Some people take vitamin D. They react, they get a symptom from it, whether it's nausea, heart palpitations, muscle cramps. Sometimes it's a headache to realize that it's probably just a magnesium deficiency, because the more vitamin D you take without magnesium, the more magnesium your body's going to have to pull from the reserves. And if you're already deficient, you're going to be really deficient now, thereby giving you more symptoms, which might happen more in the early morning when you wake up, because that's when you have the lowest amount of magnesium in the body. Another mistake that people make with vitamin D is they don't take it with vitamin K2. Vitamin K2 is another cofactor. Very, very important, because think about it. Vitamin D helps you absorb calcium in the blood, right? Well, K2, it takes that calcium in the blood, drives it into the bone and your teeth. It keeps the calcium out of the soft tissues. What type of K2 do we need? The 7 Malawian Kwacha's version is really good if you have a lot of calcium buildup in your arteries. And it's also really good for cancer, believe it or not. And the amount that I would recommend would be 100 micrograms for every 10,000 IU's vitamin D3. Next point is another cool factor, zinc. And one of the things it does is it helps you convert cholesterol into vitamin D. I would recommend, if you're taking 10,000 IU's of vitamin D3, to take like 20 milligrams of zinc. Zinc does a lot. In fact, it's a cofactor for all sex hormones. Next point I want to bring up is the mistake of not taking enough vitamin D3. If you take the typical recommended amount, which is between 600 to 800 IU's, it's not going to do anything. You need daily vitamin D3 of at least 6,000 to 8,000 to 10,000 IU's every single day. And that data is not really understood by some of these researchers. And so when they do studies, they might give the people in the study vitamin D once a week, or once a month, or even once a year. You're not going to see a lot of great results with that. On top of the fact that they don't like to publish positive things about vitamin D that are literally free. You can get from the sun. Dr. Michael Hollock, one of the pioneers in vitamin D research, recommends 10,000 IU's every single day. And he talks about this. You're not going to get any toxic effects from that. Dr. Bruce Hollis, also, personally, it takes 10,000 IU's of vitamin D3 every single day. A big part of the medical profession scares people about taking too much vitamin D3. They talk about the toxic effect. All it takes is a little fear like that to make someone hesitant. But if you look at the actual data, and I've done a serious dive into this topic, you would have to take hundreds of thousands of vitamin D3 every single day for months to develop a toxic effect. The point is that when we're talking about just 10,000 IU's, or even up to 50,000 IU's, and you're also taking the cofactors, magnesium, K2, and zinc, all three protect against the toxicity because it helps control calcium. And just as a side note on that, if you're taking high doses of vitamin D3 and you're drinking the water and you're taking the cofactors, one more thing you could do, you could actually just avoid taking calcium supplements and also foods that are high in calcium like dairy. These are all just precautionary things, if someone needs to take high doses of vitamin D3. Now, when I'm talking about high doses, I'm really talking about doses over 30, 40, 50, 000 IU's, up to 100, 000 IU's per day. Now, make note of this, I didn't say toxic doses. Okay. I said high amounts. There's a big difference. And of course, I'm just giving you data to research. I'm not telling you to do it. Check with your doctor before implementing any of the things I am mentioning. Another mistake that people make with vitamin D is taking vitamin D2. Vitamin D2 does not even come close to working like vitamin D3. You're going to need a lot more of D2 to achieve the effects of D3. The other important thing to do is to actually get a vitamin D test. And when you get a test, make sure you take your last vitamin D like 3 days before the test. So that way we can get in more of an accurate blood level of vitamin D3. The vitamin D in the blood is not the active form. So in other words, you could have this so-called normal vitamin D level and be extremely deficient in the active form of vitamin D deep into the cells. Other points about vitamin D: if you're on statins, if you're on steroids, both of those things are going to inhibit your ability to make vitamin D and allow vitamin D to work in your body. Just think about statins, right? That's going to lower cholesterol. Well, where does vitamin D come from? It comes from cholesterol. If you're going to get your vitamin D from the sun, realize that you're going to get it if you expose yourself between 10 a.m. and 2 p.m. in the summer. Also, you're not going to get a lot of vitamin D in the early morning or the late afternoon. You really have to expose a good portion of your body. If you do that and everything is right, you might get 10,000. I use vitamin D3 for maybe like 20 minutes to a half hour. Make sure you don't let yourself get burned, get slightly pink, go in the shade. And then the next day, keep working on a tan. A tan is really just an increase in melanin that allows this pigment to then protect you against the UV. Another thing not to take with vitamin D3 is iron. They compete. If you're gonna take iron, take it at a different time. The other thing is sun blockers or sunscreen. What happens is that most of the sun blockers will block a type of ultraviolet radiation called UVB, which is the type that you need to make vitamin D, but those sunscreens don't block the UVA, which is the stuff that ages your skin. So here you are protecting your skin by rubbing on this sunscreen when it's not filtering out the entire spectrum of ultraviolet light. It's only blocking your ability to produce vitamin D3, unfortunately. I hope you learned some of the mistakes and some of the things that you can do to correct those mistakes with vitamin D3.
Hypertension, or high blood pressure, is commonly known as the silent killer. This is due to the fact that there are often no symptoms associated with it. But if left untreated, its effects can be catastrophic. Medications are often what people turn to in hope of avoiding a fatal outcome. But what if they're not? What the foods you're eating could be causing elevated blood pressure? In this video, we'll unveil the top 8 worst foods for high blood pressure. And you'll also discover why the packaging of your foods and drinks could be causing it to rise. We'll also give you healthy alternatives, so you're empowered to make a change for a healthier life. Before you get the inside scoop of these foods to avoid, make sure to like this video and subscribe to the channel. We've got amazing new content each week. Number 8. Vegetable oils. Vegetable oils were once touted as heart healthy. However, evidence is emerging to suggest that this isn't the case. The issue is that vegetable oils are prone to becoming rancid. During manufacturing, they're exposed to light, oxygen, and heat, which causes them to become oxidized. In particular, it's the polyunsaturated fats, or PUFA for short, that get damaged by oxidation. This causes these fats to no longer function in your body the way that they're meant to. This dysfunction is crucial to understand. Our cells need these fats to work efficiently. A certain type of PUFA, called omega fats, are especially important as they have vital functions. One critical thing they do is help maintain flexible arteries. Having flexible arteries means they can contract and dilate with ease. When they're unable to do this, it can lead to a rise in blood pressure. A study on rats conducted in Kuala Lumpur, Malaysia, found that when these oils were heated and then ingested, the rats had an increase in their blood pressure compared to the rats that were fed fresh oil. Another form of vegetable oils called trans fats or hydrogenated fats has also been found to increase blood pressure. These oils are often found in snack bars, cookies and margarine. Avoiding store-bought versions of these snacks will help you keep away from some trans fats, and switching to extra virgin olive oil and real butter instead of rancid oils will ensure you're giving your body healthy forms of omega fats. Number 7. Alcohol. Although some people argue that alcohol helps relaxation, the findings on alcohol intake and hypertension are not solid. In middle-aged and older adults, binge drinking is associated with an increased risk of heart attacks, stroke, and hypertension. All things we certainly want to avoid. Furthermore, a 2006 review stated that the increase in blood pressure is approximately 1 mm of mercury for each 10 grams of alcohol consumed. This is concerning for anyone with even slightly raised blood pressure. But the good news is that this increase was largely reversible in 2 to 4 weeks of abstaining from alcohol. If you're worried about your blood pressure, keeping away from alcohol for a few weeks may lead to a considerable reduction in your readings. However, if you still want to enjoy some alcohol, switch to a glass of red wine a few times a week with a meal. And enjoy its cardioprotective capabilities. Next on our list is an ingredient that can be found in many different foods, from sauces to muesli bars, dried fruits to breakfast cereals. The list could go on, and so could the list of ill effects on your health. Have you guessed it yet? Number 6. Refined or added sugars. I know sugars get a bad rap nowadays, and that's not without good cause, as excess sugar consumption is linked with obesity, diabetes, and inflammatory conditions. All of these are a huge risk factor for heart disease. What makes it worse is that sugar is hidden in so many foods. And when it comes to hypertension, sugar has been shown to increase systolic blood pressure, the top number on a blood pressure reading. This is especially true of sugars that are high in fructose, specifically high fructose corn syrup. So how can we avoid it? Firstly, switching our sugar-laden treats such as cookies, ice cream and cakes is a great place to start. Instead, if you're craving something sweet, opt for a piece of fruit or a few nuts such as almonds or walnuts. Also, check the food labels of breads, crackers, cereals, etc. and see how many grams of sugar they contain per 100 grams. You should aim to avoid anything that has more than 10% sugar content. However, one of the biggest contributors to added sugar is Nexo. Number 5. Soft drinks. I know cracking open a can of cool fizzy sweetness can be just what you feel like on a hot summer's day. But did you know that 1 can of soda contains 9 teaspoons of sugar? That's a whole day's recommended intake of sugar in one foul swoop, or gulp, whatever the case may be. As we've just learned, added sugar, and especially sugars that are high in fat, fructose, can have a negative impact on blood pressure. Alarmingly, most soft drinks are sweetened with high fructose corn syrup, so the effect of the sugar may be more pronounced. Not to mention that when drinking soft drinks, there is no fiber or protein in the drink that will slow down the effect of the sugar. A 2016 study done on 5th graders concluded that consumption of soft drinks was related to increased blood pressure, thus suggesting that it doesn't just affect adults. However, the sugar content isn't the only concern with soft drinks. The fact that these drinks are often packaged in plastic bottles or aluminum cans is also worrisome. This is due to the bisphosphate phenol A or BPA that's normally found in these containers. BPA exposure has already been linked to increased risk of heart disease. A Korean study found that when participants drank from a can or plastic bottle, their blood pressure shot up as well as their urine levels of BPA. But if they drank the same drink from a glass container, their blood pressure didn't rise. Neither did the levels of BPA in their urine. Rather than drinking soft drinks, opt for fizzy water and add a twist of lemon or even some frozen berries. If possible, avoid drinking from plastic bottles or cans to eliminate exposure to BPA. The risk associated with products that have BPA in them leads us on to the fourth worst food for high blood pressure. Number 4, canned foods. Eating canned foods can certainly feel like it makes your life easier and save hours of slaving away over a hot stove. But what if the time it saves you may be adding up on your canned foods not only have the issue of BPA leaching into them, but are extremely high in salt. You're undoubtedly aware that the salt, or sodium chloride, can be dangerous for hypertension. It's estimated that 60% of people with raised blood pressure see full results of further elevation when they increase consumption of sodium. This is called being salt sensitive. Canned foods, specifically soups, have some of the highest levels of sodium of all packaged foods. One single cup serving of chicken noodle soup contains 76% of the recommended daily sodium intake. To avoid raised blood pressure, many people see a huge benefit from reducing intake of table salt. This is why we advise avoiding canned products unless they're low salt and have BPA-free packaging. Next on the list, could your salad be causing elevated blood pressure? Digging into a bowl of salad may seem like a healthier option, right? But could your salad be leading you down the garden path? While the vegetables might be supporting your health, it's what you put on the salad that may be a concoction of blood pressure enemies. Number 3, salad dressing. If you smother your leafy greens with store-bought dressings, you could be serving up a deadly concoction of rancid vegetable oils. As we've learned, these ingredients are not your friend if you want to prevent hypertension. So what are your options if you want to add some flavor to your salads? Why not try making your own dressing? With half and half extra virgin olive oil and apple cider vinegar. For an extra kick, add some herbs and crushed garlic for a heart-healthy dressing. Number 2, monosodium glutamate, or MSG for short. MSG is a form of sodium and is responsible for the flavor in many packaged foods. But some people believe there are harmful health side effects associated with it. Studies suggest MSG can cause blood pressure to rise. For example, in China, researchers collected data from 1,227 participants. They assessed their intake of MSG and their blood pressure in 2002, and then 5 years later. They concluded that intake of MSG was associated with higher blood pressure levels, especially in women. In order to avoid MSG, it's important to note that it can also be on food labels as glutamic acid or E620 glutamate or E620 monosodium glutamate or E621 or monopotassium glutamate, E622 calcium glutamate, E623 monoammonium glutamate, E624 magnesium glutamate, E625, or natrium glutamate. So be sure to pay attention to your food labels. Many takeaway foods, particularly Chinese, can have high levels of MSG. So stay away from processed and takeaway foods and enjoy some home-cooked meals. Use herbs and spices as flavoring instead. And now for our number 1 worst food for high blood pressure, cured meats. Right now you may be reminiscing about an indulgent breakfast of bacon and eggs and chowing down on hot dogs at a baseball game. These foods may hit the spot when it comes to satisfying your taste buds, but when it comes to blood pressure, they could be sending it way off the mark. Not only are these meats high, they often contain MSG. The sodium content of one hot dog contains approximately 20% of the recommended daily intake, and that's without the sauce or the bread included. Aside from these problematic additions to the meat, they also contain a type of salt called sodium nitrate. This is used to cure and preserve cold meats. The issue with this ingredient is highlighted in research conducted by scientists in New York who stated that the preservative nitrate could lead to stiff arteries. Stiff arteries lead to higher blood pressure levels as the blood vessels struggle to contract and dilate efficiently, causing the heart to work harder. These scientists performed a cross-sectional analysis of the theory. Third National Health and Nutrition Examination Survey. They concluded there was an interaction between cured meat consumption and hypertension. However, this doesn't mean that meat is off the menu instead of nitrate-free bacon that is low in sodium, and try making your own sausages. So there you have the top 8 worst foods for high blood pressure. We hope this video helps you make some healthy choices when deciding what to eat. Are there any foods on the list that surprised you? Let us know in the comments below and make sure to stay tuned to the channel to discover more wonderful nutrition and wellness insights.
Top 5 vitamins. People with hypothyroidism should use hypothyroidism, a condition characterized by an underactive thyroid gland that fails to produce or release enough hormones, can lead to a range of troubling symptoms. These include a slowed metabolism, weight gain, heightened sensitivity to cold, hair loss, and numerous other issues. So, what exactly happens in your body when hypothyroidism sets in? As illustrated in the accompanying image, the thyroid gland, shaped like a butterfly, resides in your neck. Just in front of your windpipe, this small gland plays a crucial role in producing hormones that regulate various aspects of your metabolism, including digestion, heart rate, breathing, body temperature, bone health, and much more. When your thyroid malfunctions, either by producing too few hormones or none at all, a host of problems can arise. These include hair thinning, especially at the outer edges of your eyebrows, an intolerance to cold temperatures, and overall weight gain. You may also experience persistent fatigue and feelings of depression. Some individuals may notice the development of deep, vertical ridges on their nails. Left untreated, an underactive thyroid can progress to the formation of nodules and goiters, which manifest as lumps in the neck. In the worst-case scenario, untreated hypothyroidism can lead to life-threatening conditions as your body's internal organs slow down and lose their proper function. But why does the thyroid cease to function correctly? Research indicates that 90% of cases of hypothyroidism are due to Hashimoto's disease, an autoimmune disorder in which the immune system mistakenly attacks healthy thyroid tissue. This autoimmune response often originates from damage to the lining of the gut, allowing undigested proteins like gluten to enter the bloodstream. This triggers inflammation and an overactive immune response that mistakenly targets the thyroid as a threat, resulting in damage and inflammation within the gland itself. Another possible cause of hypothyroidism is inadequate liver function and filtering out toxins or a deficiency of essential nutrients in your diet, such as selenium or iodine. Today, we will delve into 5 vitamins, used broadly to include minerals and nutritional supplements, that can aid in the restoration of your thyroid gland and the re-establishment of a healthy hormone balance. Furthermore, we will explore simple lifestyle adjustments that address the underlying causes of thyroid issues. It is essential to note that when we refer to vitamins, we are encompassing minerals and dietary supplements that can help mend your thyroid gland. To begin, let's address the first item on my list, which is of utmost importance: selenium. Selenium. If you choose to, you can incorporate a daily supplement containing either 200 micrograms of selenomethionine or selenocysteine to enhance the well-being of your thyroid gland. Selenium stands as one of the vital trace minerals required for converting the inactive thyroid hormone T3 into its active form known as T4. In essence, supplementing with selenium can expedite this conversion process, particularly for those with a sluggish thyroid. Research also indicates that selenium intake can decrease thyroid antibodies, thus mitigating the risk of your immune system launching attacks on the thyroid, which can lead to further complications. It's noteworthy that women, in particular, are 8 times more likely to suffer from hypothyroidism compared to men. This heightened risk, especially after pregnancy, often arises due to hormonal imbalances stemming from elevated or reduced estrogen levels. However, selenium rebalancing these hormones by promoting liver health and bolstering the body's antioxidant defense, including the vital glutathione. Now, moving on to the second supplement on my list, bile salts. Surprisingly, many are unaware that a significant 80% of thyroid hormone conversion occurs within the liver rather than the thyroid gland itself. Therefore, simply relying on thyroid medication may not address the root cause, which could originate from liver or gallbladder issues. These issues might include a fatty liver, gallbladder stones, or the accumulation of toxins like mercury in the body, all of which can trigger inflammation and hinder thyroid hormone conversion. If you're interested in improving your liver health, consider supplementing with bile salts. You can take 2 capsules before each meal of the day. This helps to thin out the bile in your liver, facilitating the conversion of T4 to T3, while also aiding in the detoxification of toxins such as mercury, other heavy metals, and harmful chemicals present in your diet that may irritate your thyroid gland. Number 3. Vitamin C complex. As discussed earlier, a staggering 90% of thyroid cases are attributed to Hashimoto's disease, an autoimmune condition where the immune system mistakenly attacks the body due to excessive activity. This often arises from damage to the gut lining caused by the consumption of grain-based foods like bread, pizza, popcorn, cereal, biscuits, cakes, and pasta, which contain the protein gluten. Thank you. Gluten damages the intestinal lining, creating tiny openings that allow toxins and undigested food particles to enter the bloodstream. As the immune system doesn't recognize these foreign substances, it launches attacks throughout the body, leading to inflammation and various health issues. Interestingly, the thyroid tissues share a similar protein structure with gluten, prompting the body to target the thyroid gland as if it were an invading pathogen or virus. This is where vitamin C becomes indispensable. A genuine vitamin C complex includes bioflavonoids that promote collagen production in the body and aid in the healing of the gut lining. For an added boost, you can incorporate 1,000 mg of vitamin C through sources like acerola cherry capsules or powdered fruit blends into your daily regimen. However, be cautious when selecting vitamin C supplements, as those containing only ascorbic acid, which represents a mere 5% of the complete vitamin C complex, may not be as effective. To truly heal your gut, it's advisable to obtain the entire vitamin C complex from foods like cabbage, sauerkraut, strawberries, bell peppers, and cruciferous vegetables. Number 4. Iodine and zinc. Trace minerals are indispensable nutrients that our bodies require in minute quantities, yet they play a pivotal role in catalyzing thousands of chemical reactions by supporting various enzymes. Previously, we emphasized the importance of selenium in thyroid health, as it aids in neutralizing free radicals produced during thyroid hormone synthesis, thus reducing inflammation and enhancing conversion. In addition to selenium, zinc is another critical mineral that facilitates the synthesis of new thyroid hormones. Iodine, on the other hand, serves as a fundamental component for the production of T3 and T4, the primary thyroid hormones. To incorporate more of these minerals into your diet, consider adding seafood options such as sea kelp, nori, kombu, Irish moss, mussels, clams, crab meat, and oily fish to your meals 2 to 3 times a week. Alternatively, you can opt for liquid trace mineral drops mixed with water or sea kelp capsules to supplement your trace mineral intake. These minerals not only support thyroid function but also contribute to healthy skin, hair, eyes, and nails by aiding in the regulation of cell growth. Number 5. Vitamin D3. Consider a daily intake of 10,000 international units of vitamin D3, along with 100 micrograms of vitamin K2. These vitamins play a crucial role in hormone balance and reducing inflammation in the thyroid gland. Vitamin D, in particular, acts as a hormone that modulates and regulates the immune system, preventing it from mistakenly targeting the thyroid. Research indicates that individuals with hypothyroidism often have insufficient vitamin D levels. usually due to limited sun exposure or inadequate endogenous production. Higher doses of vitamin D3 are frequently employed by functional medicine practitioners to address autoimmune conditions like Hashimoto's. Furthermore, vitamin D enhances liver function, promoting hormonal equilibrium and detoxification, which can mitigate inflammation in the thyroid. Before making any dietary or medication adjustments, it is imperative to consult your doctor regarding the use of these natural remedies. If you suspect you have an underactive thyroid and seek a definitive diagnosis, there are at-home blood tests available for your convenience. Now that we've explored various nutritional supplements for managing hypothyroidism and discussed testing options, let's delve into the underlying causes of this condition. As previously mentioned, excessive consumption of gluten or grain-based foods can harm the gut lining, triggering an autoimmune response in the thyroid. Another contributing factor is the overconsumption of deep-fried foods and inflammatory vegetable oils, which can damage the intestines and liver, leading to inflammation and toxin accumulation within the body. It's worth noting that approximately 80% of thyroid hormone conversion occurs within the liver. Thus, liver disease, especially in individuals who are overweight, can impede thyroid function. Prolonged mental stress, overtraining, or the onset of menopause can elevate cortisol levels excessively, signaling the thyroid to produce fewer hormones. Additionally, insufficient dietary intake of iodine and selenium from wholesome sources may hinder thyroid hormone synthesis. Certain medications, such as statins, diuretics, antibiotics, and blood pressure medications, can induce hormonal changes that weaken thyroid function. Now that you're aware of these factors, let's delve into 6 lifestyle tips aimed at enhancing the well-being and functionality of your thyroid. 1. Eliminate grains, vegetable oils, and gluten from your diet completely. This includes foods like bread, popcorn, canola and soybean oils, corn oils, biscuits, pasta, tortillas, rice, and more. Maintain this dietary adjustment for a minimum of 90 days. You can aid in the restoration of your gut lining by incorporating bone broth, raw garlic, kefir, sauerkraut, and low-glycemic berries into your diet. 2. Incorporate anti-inflammatory organic foods such as steamed broccoli, cauliflower, leafy greens, radishes, celery, and Brazil nuts into your meals. Include pasture-raised eggs, wild-caught salmon, sardines, grass-fed beef, organic pork, and shellfish rich in trace minerals. 3. Avoid adopting a low-fat diet, as your body requires specific fats for hormone production. Sources like virgin cod liver oil, pasture-raised egg yolks, and grass-fed butter are excellent providers of retinol, a compound that assists in activating specific thyroid receptors. 4. If you find yourself under significant mental stress and experience tension, consider taking ashwagandha capsules and enjoying lemon balm tea. These natural, ancient adaptogenic herbs can help reduce cortisol levels, alleviate stress, and balance estrogen levels, which could be contributing to hormonal imbalances. 5. Consider incorporating some of the supplements mentioned in today's video. So, particularly those containing bile salts, to enhance the conversion of T3 to T4 within your liver. Seek out supplements that contain bile acid factors, bile salts, ox bile, or TUDCA. These substances can aid in detoxifying the liver and intestines by eliminating toxins and undigested proteins. 6. Last, but not least, adopt timed eating habits. Consume all your daily calories within a 6-hour window, allowing your body 18 hours of fasting. You can still consume the same quantity of calories as you would throughout the day, but confine your eating to this specific time frame. This practice triggers autophagy, which can reduce inflammation, regulate an overactive immune system, and prevent further thyroid complications. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Hey viewers, and welcome back to Bestie. With the low-carb craze going strong, high-carb bread seems to be slowly making an exit out of people's diets. Now before we move ahead, let's clear up one thing. When we say bread, we're talking about the kind that's made of refined wheat, like white bread. These breads are heavily processed and contain hardly any natural ingredients. Thousands of people have been sharing information about what's changed in their lives since they've decided to quit eating flour-based products like bread, and the positive results. Well, they speak for themselves. In today's video, we'll tell you what would happen if you stopped eating bread for a month from reduced illness, more energy, improved digestion, weight loss to clearer skin, and more. Watch until the end to find out all of them. You'll have more energy. Remember the last time you ate that big sub for lunch and were dying for a cat nap? Many of you may be familiar with this afternoon slump, and the reason why you often crave a nap after eating bread is because of the heavy dose of carbs you get from it. Here's something to keep in mind when it comes to carbs. They trigger the release of feel-good brain chemicals that help us to relax. So when you eat high-carb foods like bread, you tend to become more relaxed and even sleepy. In addition to that, bread is a high glycemic food, and these are notorious for causing blood sugar level spikes. Now this rapid rise in blood sugar may initially make you feel more energetic, but when the levels go down, you'll find yourself feeling very tired due to the energy crash. Do you suffer from an afternoon slump after a carb-heavy meal? What do you do to deal with it? Share your experience in the comments section below. Number 2, you'll lose water weight. When you reduce your carb intake, the first thing you'll notice is how quickly, even magically, the weight falls off. But it's not fat you're losing. It's actually water. When carbs are stored in the body in the form of glycogen, each gram of carbohydrate stores 3 to 4 times its weight in water. As soon as you cut your carbs and start using your glycogen stores, you'll lose a good amount of water weight. Number 3, you might feel like you have the flu. Ever heard of something called the low-carb or keto flu? Yeah, I mean it's a real thing. It's not fun. When you cut down on carbs significantly, you might deal with flu-like symptoms like drowsiness, itchiness, and nausea. A lot of these issues have to do with your brain, which typically uses a ton of glucose, because it has so many nerve cells. When your brain doesn't have enough glucose to run full steam ahead, it has to transition to using fat. Your nerve cells don't function properly, and you feel terrible. Plus, people on a low-carb diet often lose out on electrolytes like sodium and potassium, which can lead to some flu-like symptoms, as well as issues like heart palpitations and muscle cramps. The low-carb flu should subside once you're a few days into ketosis. But if you're not quite low-carb enough to make the shift, symptoms might stick around. You will have a reduced risk of various illnesses. Bread is made up of anti-nutrients like gliadin and glutenin. Not only do they not provide any benefit for your health, they literally attack your body as you eat. In fact, nobody's digestive system is equipped to properly handle gluten. Although a certain number of people are diagnosed to have gluten allergies, these people are just more sensitive to it than others. Our bodies do not have the enzymes to break it down. It all depends on how well your intestinal walls close after we eat it, and how our immune system reacts to it. Wheat contains compounds which can increase your risk of leaky gut syndrome by increasing intestinal permeability. Furthermore, avoiding bread will reduce your risk of chronic inflammation and joint pain. So cut it out of your diet can significantly reduce your risk of chronic illnesses. Number 5. You won't have as many cravings. Refined wheat bread is devoid of any nutritional value thanks to the manufacturing process. It's stripped bare of any nutrient-rich wheat bran and germ. This is why your body finds it easy to digest and can convert into glucose. This can cause your energy levels to spike. Your body doesn't really get any nutrition or fiber from eating bread. This, along with your glucose levels dipping low, can make you feel hungry more often. So avoiding bread can stop you from craving more simple carbs and unhealthy snacks throughout the day. In fact, it would be best to replace bread with plenty of fruits, vegetables, and occasional complex carbs to keep your gut feeling full until the next meal arrives. 6. You lose weight. As every person who has ever been on a diet knows, bread is one of the biggest enemies to weight loss. The first piece of advice your dietitian will give you is to stop eating refined white bread. This is because the high level of refined carbohydrates in bread makes your body retain water weight, which can make you feel bloated and heavy. So when you stop eating it, the pounds will come off naturally, especially around your waist. It's because refined grains are one of the main causes of excess belly fat. Not only will you look great, but you'll also feel great. Improved digestion. People who eat a lot of bread tend to have digestion issues. Gluten in general is very hard on the digestive system and can cause bloating, diarrhea, vomiting, and stomach cramps. People who may not think that they're allergic to gluten may have gluten sensitivities that make regular digestion difficult. If your digestive system isn't functioning properly, you can have a hard time losing weight or even develop certain diseases due to toxic buildup. Clearer skin. You've most likely heard the saying, beauty starts from the inside out. Well, there is also a similar saying in the health and wellness community which goes, what happens on the inside of your body will be directly mirrored on your skin. Bottom line is that your diet is going to be the number one factor that affects your overall skin health. So if your goal is healthy and glowing skin, you must make it a top priority to maintain a healthy diet that's rich in key skin nutrients. That understood, oftentimes people don't even realize that they do have a dietary sensitivity to wheat and gluten, which are both found in many varieties of bread. And in the case of wheat intolerance and gluten sensitivity, the symptoms can range from mild bloating to more bothersome symptoms, like chronic acne. Now, unfortunately, in the case of conditions like wheat intolerance and gluten sensitivity, the solution is very simple. Avoid bread altogether. Your workouts may suffer. Carbohydrates are the body's primary source of energy for fueling all exercise. 10. You might get anxious. The feeling of anxiety is something that happens once you eliminate carbs from your diet. This is because carbs increase the brain's level of the feel-good culture chemical serotonin. So once you cut carbs, your psychological state goes along with it. The less serotonin you pump out, the more likely you are to feel bummed out. Your brain uses carbs as fuel for everything, including exercise, both endurance and resistance workouts. Reducing it can lead to a major drop in energy levels, and lesser workout means lesser serotonin production. Did you know that you can manage anxiety levels by eating the right foods? Now back to what happens when you stop eating bread for a month. You might have bad breath. A lot of people who follow a low-carb diet into ketosis report bad breath. These ketones that are fueled by your body at this point are released, also through your breath. Additionally, during the first stage of the low-carb diet, as you lose water weight you can develop dry mouth. That makes for a stinky breath too. Even if the dry mouth goes away, the halitosis caused by quitting bread won't. The only way to counter this bad breath is to drink a lot of water or to chew parsley. Bad breath can also be a sign of GERD, diabetes, or gum disease. Lower cholesterol levels. Whole wheat bread has been found to increase bad cholesterol by up to 60% over a 12-week period. This has been linked to various heart conditions, including heart disease. This surprising statistic is the result of high amounts of wheat and flour in most bread types, which have been directly linked to an increase in cholesterol levels. Bread has the ability to raise cholesterol levels without technically being high in fat content. In fact, its impact on bad cholesterol levels is currently an igniting debate between nutritionists and other medical professionals. Some nutritionists continue to argue that fat has the most significant impact on bad cholesterol levels. 13. Lower diabetes risk. Refined carbs in bread increase the levels of fatty acid that increase the risk of heart disease and type 2 diabetes. Eating whole grain